All right, Miss Rhonda, we are live. We are live.
Hello. Yes. Hello, everyone.
Rhonda, for our audience, and I know that it takes a 20-second lag to get people on here, but just as they're coming on, I just want them to know you and I go back such a far way. Um, so for me, it's a pleasure really to have you here because I know your work. I know how dedicated you are to your community. Rhonda and I served on the same board. Rhonda was on the board of my own charity some years ago. Rhonda has been on several boards. She is a true leader in the community. We actually met at Leadership Palm Beach, right, in 2011.
Exactly. Yeah, 2011, class of 2011, the best class ever.
Best class ever. That's not what people said though, but
I know that's right. I know that's right. We know the inside scoop, right?
the inside school, we had too many lawyers in our class. I think they call us the most inquisitive class
Inquisitive
ever.
class. That is actually our real name. That's
That
right.
is really our name.
Inquisitive
And
class.
it was an appropriate title. We asked a lot of questions, we pushed back. But that's what we do, right? We don't just take people's word for it. So Rhonda, it's so good to have you here. And I'm going to give you a time just to introduce yourself, what you've been up to. In the introduction and the feed, I put that you're the founder of Rhonda's Promise, which I know since 2011 when we met, you said, I want to have my own nonprofit one day.
Yeah.
At the time you were working for another nonprofit, and it was in your heart to do your own nonprofit. I know you're always out there working with women. I know you were part of one of the Black women group. You were the president there for a while. I know you were part of the Women's Chamber of Commerce. So you've been really working in the community a lot. And I was looking forward to this because our work at Cancer Equity Project and Total Health is engaging the community, especially to tell them about what we do on the cancer space and how to build awareness. Our main mission is to really end inequity in healthcare, and we know that we need partners like yourself to help us get the message out. So I'm going to turn the floor over to you, Rhonda, and I want you to just introduce yourself and what you've been up to, and then we'll get into a little bit more.
All right. Well, I'm Rhonda Rogers. As you mentioned, I'm a Florida native, born and raised right here, and I'm very involved in our community at different levels. As you mentioned, 100 Black Women, the National Coalition of 100 Black Women. We have two chapters here in Palm Beach County. I'm part of the West Palm Beach chapter. I'm also a member of Delta Sigma Theta Sorority. I'm the immediate past president there, and I'm involved in the Women's Chamber and Leadership Palm Beach. I'm on that board. And I just like to be involved in the community and really lend in my expertise when possible. I also do a lot of consulting with other nonprofits, individuals who want to start a new nonprofit, or C-level suite coaching, because I've had quite a bit of experience with that over my tenure here. I was excited when you called and asked me to speak today about this because it also hits home for me.
Mm-hmm.
My family and I are personally going through our own challenges with our mother being recently diagnosed with her illness, and just being an advocate and just watching her be the advocate for herself. She's so strong, and she kind of gives us the strength to continue this work. So I was very pleased to have the opportunity to speak today about health inequities related to Black and Brown women. At my time my time in the national leadership level with the National Coalition, we did a lot of programming, and one of our main areas is breast cancer. So we were able to do a documentary on the local level here with several different young ladies who were going through breast cancer. And what we found was a lot of times we were diagnosed late, too late.
Yes.
By that time, our insurance wasn't adequate. They were getting physicals and checkups, and it just wasn't being detected. A lot of them detected the lump themselves. As we know, I have a lot of personal friends who've gone through and survived. So it's not always a death threat, but we have to catch it and we have to be advocates. And some of the things that came out in the documentary was just making sure that we got to the doctor, and when we got to the doctor, that we were asking for all of the different tests. A lot of times we talk about mammograms. Well, sometimes you need to go different and do the ultrasound, especially with Black women. I'm one that has very dense breasts. So whenever I get my mammogram every year, they do ultrasound because you can't always detect everything on just the machine. So, like I said, this is a personal journey for me, and I appreciate you having me here today to kind of speak on what we're going through and what we've been through and how we're going to solve it, at least try to solve it, at least be the advocate, because that's what we basically can do at this point, is be advocate and bring awareness to this issue.
Well, I'm just so pleased with what you're saying here because we hadn't even talked about that and the documentary. So I'm just so pleased. And you're right with regards to Black women, with the dense breasts. So I have, and you're right, early detection is key. As I think I might have shared with you, Rhonda, I was diagnosed with breast cancer almost 2 years ago. And the truth is that because I had the dense breast, I was always doing 2 tests per year, the mammogram and then the ultrasound. But because of COVID, and no one, people weren't getting tested during COVID. But even so, I was still caught so early because I'm a person who's just always on top of it because the doctors, tell you, as your breast, you're higher risk. So I am just so glad that, I have you on here because we entitled this show Black Women and Health. And there's so much to uncover and unpack. I want to talk to you about your mom and how she's advocating for herself, because I think we can all learn from that. I think one of the misconceptions that's out there when we talk about equity and inequity and disparities that I just want to just clear up is that people aren't asking for handouts. They're not asking, Black people aren't feeling entitled, right? They're not, Black people.
We just want a fair chance. That's right.
Just a fair chance. Just a fair chance. And so what we're doing with our work at Cancer Equity and Total Health is we are educating doctors. We have a program called Seek. We actually have one this weekend in Memphis. It's our second one for the year. And it's where we bring in DEI speakers to talk about cultural relevance, cultural humility, disparities, microaggressions, privilege, disparities. And we are trying to educate doctors. Like, we're not blaming doctors. We're trying to educate them. Like, here's the Black experience or the minority experience or the underrepresented group. It could be LGBTQ, American Indian. Here's how they're experiencing doctors in general. And we're trying to train them how to shift their consciousness, how to become a little bit more culturally relevant so they can give us the proper equitable care. At the same time, Cancer Equity Project is also bringing on people like yourself, Rhonda, because we're saying, hey, on our side, the patient side, we want to empower the patients to be their own advocates. So if they end up going to a doctor who is not trained on DEI, not trained on cultural sensitivity, then we can at least know what we should ask. So I want you to talk to us about, because you shared with me about your mother's journey. And I don't know your mom. I see her picture, but I just admire how she's going about her stuff. So we're not gonna disclose her diagnosis, but let's put it this way: she's been diagnosed with something, and tell us how she's handling that, Rhonda.
Well, to me, she's handling like a trooper. She is one of her biggest advocates, as I was sharing with you. She keeps a binder. She's very dedicated with keeping her binder, keeping her records, and making sure she knows what she is being prescribed and what it's supposed to do and what it's for. And so I love that about her. I was just sharing with you. My sister is her main source of caregiver. Like, she makes sure she's there with her at every appointment. They come to know my sister and make sure they check in with her and let her know what's going on and what her treatment plan is for the week or even for the day, because sometimes it's day by day. So I do want to shout out my mom and my sister and thank her for being that person. But what I love about her is, I was sharing before that she's gotten bumped. She has a certain time. She likes early morning appointments. So 8 o'clock, they would bump her like one time at 10. And she was like, absolutely not. I need this. My daughter has to get to work. This is the time frame. Why did you choose me? Why am I being the one that's being bumped? And so she would ask those questions and push. And even when it comes down to her provider, if she goes in the office and they try to give her another nurse practitioner, another doctor, she's like, no, these people know my treatment plan. They know what I've been going through. They've been here since day one of our diagnosis. We have a plan. I need to see this doctor. I need to see these nurse practitioners, and I need to make sure that my medication and everything is being handled properly. So I love the fact that she speaks up for herself. And she's just not sitting back, letting something that this happen to her. She's actively involved in her treatment plans and wants to live. When we were all together in the office, the doctor was like, "Do you want to know with the outcome, like, they give you the statistics, like, 10% will live or 20% will live. We don't want to hear that. She's living, she's moving forward. We don't want to hear the statistics. We want to talk about her plan and where we are right now to get her to a healthier lifestyle. And that's what
Wow.
I love about her, and her positiveness. She's very positive, has a very good outlook. A lot of times I know she's not feeling good, but whenever I call her or the other siblings call and check on her, it's always, I'm doing good, I'm doing fine, but you can hear it.
Yes.
That when there's good days and bad days, and we know that's all part of the process and the journey. But what I would encourage any woman or male to do is be your advocate. Make sure you're documenting things that's going on. Don't let things happen to you. Be a part of the planning and be engaged with this whole entire process. And ask other questions. What I love about her is now that she goes for her treatments on a regular basis, the folks they're like a little cohort. They're like a little group. And they check on each other. And if they don't see someone at that time, they'll ask what's going on. And then, she had some issues with eating. So she just didn't have a taste. Some of this medication takes the taste out of her mouth and things like that. So they talk about things, they give advice to each other. Well, when I was going through that stage, ice chips helped, or ice cream helped, or make a protein shake. So I'm loving the little community that which they are all being treated and are working together in the doctor's office to make sure that they all are on the other side, that they all get through this together.
That is amazing. So is the community was the community started by the doctor, or was it just organic?
It was just organically. They all had the same doctor's appointment, so they all get their treatment. She was a early morning crew, so they say they're all the 8:30 in the morning crew, and they just kind of build amongst each other camaraderie to where now they know each other's names and they check on each other. Like I said, if someone's missing, they didn't come that day or this week, they're asking the nurses like, hey, how they doing, how they feeling, that type of thing. They kind of just organically became a group.
Now, without giving away your mom's full, proper age, give me a age range, because your mom sounds really sharp. Because when I say really sharp, she's really on it with her attitude, with her mindset, even pushing back. Part of the problem is a lot of patients, right? Especially older patients, especially patients from underrepresented groups, they don't believe that they have rights.
Right.
And so if you tell them something, they'll just accept it. And it doesn't seem to be the case for your mom. And I'm not quite sure where she got that attitude from, but we're very thankful for it, because she's giving an example to the next generation and generations as to how to really advocate for yourself. And I wonder, Rhonda, if you could tell us, when you're speaking to your groups, like you mentioned a documentary,
mm-hmm.
how can we educate the community better? Because how can we get more women like your mom? For example, Rhonda's Promise. I believe you work with some senior women in Rhonda's Promise.
Aging gracefully, 55 and older is that group.
55 and over. And you probably should have your mom as a speaker there when she's feeling good, because she's an example of being older but being vocal.
That's right.
And sometimes we wait on a diagnosis to then start to learn. And there is a feeling, I know in the Jamaican community for sure, they don't like to even call the word cancer.
That's right.
This is a feeling that if you say the word cancer, you're going to get it. You're going to catch it. And so there's a lot of denial in some of these underrepresented communities. And this is from lack of education, lack of knowledge. It's the reason why people don't go get their mammograms, why they don't go get checkups, because they don't want to know. And what we're saying is, no, the advantage is to know, so that, because like you said, Rhonda, there are many people who caught it early and they're living their best lives, right?
That's right.
But we also know the opposite too, that people didn't catch it early and they did not, they didn't get their best lives lived. Mm-hmm. So spreading awareness is huge. And I'm just wondering, through Rhonda's Promise, and I have a question I have to take up here for you, but I'm wondering, through Rhonda's Promise, what can you do for those 55 and older women, or what are you doing to spread that awareness? But before you answer that, thank you for sharing your work, Rhonda. Where do you think the system is failing women of color in breast cancer? Is it in screening or diagnosis? I know things like diagnostic mammograms, as opposed to regular mammograms, can have high co-pays.
And I think that's exactly where it is. It's in the screening. A lot of times we're not offered, or we don't have the proper insurance to get it covered. That's why we do work with folks like Sojourner with Healing Hearts. They do have them in their van, and they make sure that the women get the necessary screenings. They're also in our documentary, but I think that's exactly where we're failing. We were not getting tested early enough. So one of the programs that we started is called Do What's Best for Your Breasts. And that's what teaches women how to do their own self diagnosis, because the two ladies that I mentioned who are both very close to me, who were recently diagnosed, such as yourself, within the last 2 years, who are survivors, they found their own lump. They found their own lump. They went, contacted their doctor, and immediately started getting treatment. And one ended up getting both her breasts removed and getting reconstruction and having her implants done. And now she's out traveling and will be a great person to speak to from the survivor's point of view. We do know some younger women who weren't diagnosed, and it spread. It went from breast cancer to something else. And so those were fatalities. Those folks did not make it. So you see some of those ladies in the documentary that we learned later on, because it was brought to our attention. It's got to be at least about 10 years old, our documentary, that we should probably do a Where Are They Now?
Yes.
You know, for a fact that one of the young ladies did not make it. So that's just something for the coalition to consider at a later date. But breast cancer, as I mentioned, is one of their programs that we do on the local level and on the national level.
I definitely want to get connected with you. We'll talk off camera, because I definitely want to get involved with you and with them with that, because we are going to be doing our own clinical trial called the Ebony trial, and we will be, and this is what we're planning for now, to be the largest enroller of Black women.
Okay.
It's for women who are under 50, diagnosed with an early stage breast cancer, hormone positive breast cancer. We're going to start with that particular trial, and there's details forthcoming. But we want to educate the Black woman, educate the community that, look, this is safe, right? We're not. No one's going to force anyone, but we want to give you the options, because clinical trial has saved a lot of lives.
Mm-hmm.
We have a woman on our board right now. She's 15 years or 16 years out as a breast cancer survivor, who had a very aggressive type of breast cancer 16 years ago. She tells her a story, but her doctor put her on, introduced her to a clinical trial that saved her life.
Wow.
Saved her life. She's like, hey, this clinical trial, I think you'll be good for it. And she said she credits that trial for saving her life. And Sarah, my partner, who is not here, because she's a scientist, and she and a bunch of other professional people, right? People who know this stuff, scientific minds, they're working on this trial to be launched maybe later on this year, or latest early next year. But it'll be the largest percentage of Black women being enrolled, because we're trying to find solutions for Black women. So
that's one of the things that we talked about. Rhonda's promise, would love to partner with you on that. We know several of the funders here in Palm Beach County. I want to shout out some of them. Palm Healthcare, come on, we need to have a conversation with you and talk about how we can do this, because this is so needed. And like I said, it would be great to pick up where we left off and take it to a whole nother level. To really help advocate and bring awareness. Those are the two things that we have to do: advocate and bring awareness. And I'm right here to be in the fight with you, sister.
Absolutely. Palm Healthcare, we're going to tag you on this post, because
that's
we're coming
right.
to you. We need some funds. We have work to do. We need some funds. We have another question for you. Can you tell us what sources have you or your mother used to educate yourselves about her condition?
She asked, the doctor has met with her. She's also talked with a couple of doctors in Tampa. They tell her the different things that she can do as far as after, because she is going through chemo. It is a cancer. I am okay with saying that she is going through chemo, and that brings on a toll to your body as well, outside of the diagnosis. So she has to deal with those side effects and things like that. So her doctors and any information from local doctors, as well as doctors over in Tampa is what she's been doing. But what I like about her is she had been not feeling well for well over a year. She had been going back and forth from the Cleveland Clinic. They could not diagnose what it was. And we finally did get a diagnosis about 2 months ago. So now she's into a full treatment plan, which is a big relief, because that was the scariest part, is not knowing what is going on with her, and the losing the weight, not having the appetite, the fatigue. She knew something was not right with her body, and she kept going to various doctors and just was not able to get the diagnosis. So we're more relieved. We're not, we're not pleased with the diagnosis, but she has
Right.
a diagnosis, so you can have a treatment plan so that you can get past this. And that's
Yes.
what we're trying to do. That's our game plan.
Again, even Rhonda, even as we're educating people, people out there, listen to your body. Your mother listened to her body. She didn't stop. She kept going to the clinic. She kept pushing until that is just, again, so admirable. And as we educate the women in the community, we want to tell them, don't just ignore that weakness or tiredness, or you're losing weight, or that fatigue, or something is itching you, or don't just ignore it. Check it out, because your mom is a poster child for persistence, and advocating for herself.
And I'm not afraid to share her age. She's in the early 70s. She looks phenomenal. And
Yes,
so
yeah,
yes, and so she was a walker. She was, her body was in good shape. That's how she knows. I just recently, like December of last year, we took my boys, to the theme park, and she walked the park better than me. And I'm in my 50s and I was exhausted.
right,
So
wow.
just in December, that just shows you how quickly your health declines,
Yeah, yeah, that is really true. I just want to give a shout out to one of our listeners, is Sammy Mansfield. She talks a lot about exercise, and how that it helps to prevent cancer. But even if you got the cancer, you're in a better position, like your mom is, for recovery, and
Mhm.
for recurrence. It minimizes
That's
that.
what the doctor said. They said she was young. They encouraged her early 70s. You're still young. And that makes her feel, she is still young. And that also
Yes,
makes her feel good because the doctors have such a positive outlook on it as well. And the folks in the doctor's office have such a positive outlook that it helps encourage her.
yes. So many nuggets there. Again, back to the doctors. When you and also too, I like when you guys said, I don't want to know. I don't want to know the prognosis of how many years I have. I love when you guys said that you don't need to know, because you don't want that in your mind, like, okay, it's 5 years or it's 3 years. You're gonna live, and that you're gonna do everything to live.
That's
And
right.
and the doctor being positive is very helpful, because you feel almost like, if they believe in you, you can believe in yourself. And I know you guys are people of faith as well. So between the prayers and the community, and I know you have a big community, Rhonda, of supporters. So that's helping her. And then she formed her own organic community. So your mom, again, is just an example of how to really fight this thing, with all the tools. What has been your experience with attitude about clinical trials in women of color? Are they receptive or hesitant to the idea of being in a clinical trial? Peter, by the way, is a scientist as well, and so that's his background. So he's
I
into
think
the
it's both. I think it's both. We're going to always have those folks who remember what is it, the Tuskegee experiment.
yes,
So it's
yes,
the same thing with getting the vaccine. We were very out there. The National Coalition was out there. Delta was out there, really telling people to get the vaccine, and we still heard both sides of it. Our people
right,
are definitely not ready to just take any kind of injection, and so I think it's going to be the same. We're going
yeah.
to have those who are going to be open up to it, and then we're going to have those that we're going to have to educate and really sell them on the clinical trial. It's not going to be an easy cakewalk. I do understand that.
Yes. I think, Peter, what I would add to that, I think what Rhonda is saying is true, because in the Black community, people didn't realize this, but many Black people were anti-vax. My own son wouldn't do it. Many people were, and it wasn't political. It was a matter of just trust.
That's right.
There's a
That's
lot of
exactly what it was. What are you putting in your body? And now
yes,
today you're still hearing, I don't know if it's rumor or not, but it's now the new rumor out that whatever happened with Jamie Foxx was the kind of vaccine. So,
right,
it's like it's a constant thing that they're going to say about this.
right, right. That is a truth. That is so true. Um, so I have one more question about this clinical trial thing. I think, Peter, yeah, my question, my answer to that too, Peter, is we are going to have to get Black women who have been part of a clinical trial experience, like Dee Burrell, to say, hey, I was diagnosed with a very aggressive cancer 16 years ago, or whatever, or 10 years ago, and my clinical trial saved my life. And until Black women see other Black women who
That's
went
right.
through, it's just not gonna happen. And so That's going to be the climb that we have. But I believe that we can, find those women, and it's not a large number. I think Sarah said that the statistics were 3% of women or less, and I don't quote me on it, or of Black women are enrolled in these trials, or less
Okay.
than 3%, like the tiny amount. And so the treatments that are standard of care, they're not always as effective with a Black woman cancer or a Black person's cancer because they weren't represented in the trials.
Mm-hmm.
So that's the reason why clinical trial is so important, for us to get more Black people enrolled so that the treatments can be developed more, more targeted for maybe like a Black person, because they don't know if the type of cancer that we have sometimes is a little bit different because there's not enough data in these clinical trials. So a lot of education. But Rhonda, I'm glad to be back in Florida because I know I know you're my girl to get me out there with the community. So I'm so glad for that.
Yeah, I'm looking forward to what we can do. I think it's going to be exciting. We know it's going to be hard, but like you said, it's doable, and we're going to get it done. We're going to get it done.
We're going to get it done. So we like to end our show, Rhonda, with something uplifting. It's called T Talks, because the T cells, it's based off this word T cells. The T cells are the happy cells in our bodies that fight cancer cells. Okay. So we that's why you should watch comedy, laugh a lot, go into the sun when you have cancer, because it builds up your T cells, and the T cells are like the policemen in your system.
Mm-hmm.
Let me just ask, Peter, I can totally relate to distrust about the vaccines. The problem is we need more minority enrollment in trials to get the data to reinforce the guidelines appropriate for everyone. That's right, Peter. That's what we just said. And yeah, that's where we need.
I agree with you wholeheartedly.
Yeah, yep, we agree, and it's where we need advocacy. Oh, Rhonda, you have a fan on here. It's Wayne.
Who's my fan? Hi, handsome man.
He says, thank you for your advocacy, for being here today. I love your mom's attitude, and it fills me with positivity. I know the mental game is a big part of healing, so glad to reconnect with you. Yes, your mom's story is inspiring to us, and we are going to pray for her, and we wish her, and we are going to hope for that 100% recovery. Her attitude is great. Her body was ready in terms of her exercise abilities. She has you, she has your sister, she has a community. So we're going to continue to pray God's healing over her, in addition to whatever the doctors are doing. Amen. So Rhonda, leave us with one thought that leave the audience with one thought that could inspire or lift us up, and maybe something from your mom, about you, whatever, that we can end our show with that positive goodbye, so to speak.
I just want to encourage everyone to be their best self and be their best advocate, and understand that whatever you're going through right now is just for a moment. This is just for a moment. So take it day by day, breathe day by day. Sometimes we take it minute by minute. And so I'm just here to encourage you to be your best self, live your best life, and take nothing for granted. This is one thing that I can say. My sister and I, and all of my siblings, that we were very close to our mom. We spend time with her. We've taken trips. We've done things. We go to dinner. We just embrace your family and be there for her. So if anything happens, there is no regrets, and that you're living your best life day by day. And so I just encourage everyone out there to be your best advocate and be aware of what's going on with your body and with your family.
That is a great, great, great advice. Take nothing for granted. Live your best life. Hug your loved ones, because you never know. As Rhonda said, her mom was fine in December, and a couple months, ago, she heard, she had a diagnosis, and she, wasn't there in December. So, but thank God her mom has a positive attitude. Thank God her mom was taking care of her body, knew what it felt like to feel good, because she was a walker. She was exercising. She was a young 70. And thank God that she has good doctors who believe in her prognosis. And that's a really big mental game as well. So we're so thankful for your mom's story, Rhonda. We're thankful for you. We know you're a good daughter, and I'm sure your sister is as well. So we're thankful for you, and definitely looking forward to catching up with you in person soon.
That's right.
We need to go after some money together.
That's right. No, hey, we both know how to do that, right?
We sure do. We
So
sure do.
yes, we're looking forward to it. That's why I said we're in this fight together. When you first mentioned it to me, I text you like, how can I help? How can we partner? Because I know that there's funds out there, and I know that this is needed.
Absolutely. Well, folks, thank you for watching and thank you for supporting Tea Talks. Until next Monday, we're signing out. Take care.